where I want to start is for those people who are thinking about weight loss surgery, for those people who have thought about it, who are on the fence. How do I communicate and talk to patients when it comes to weight loss surgery? Usually, it's in the form of a question. For many patients who have weight-related chronic conditions, blood pressure, diabetes, heart disease, significant arthritis, heart failure, the list goes on and on, sleep apnea, and they're asking about how they can improve their health. I normally ask, if they don't ask, I've asked, so have you thought about weight loss surgery? Or what are your thoughts about weight loss surgery? It is usually a open conversation. There are some patients who feel strongly, and I don't want to come off as pushing people who aren't prepared into a significant investment in your health like weight loss surgery. It's there's a lot of work with it, and so you really have to um, kind of be committed. I have a lot of friends who have been pushed toward it, and they're not ready yet. And my advice is usually don't do anything until you're ready, because you're going to have to do the hard part that will make this a successful procedure. And so if you're not ready, then take your time, learn more about it, ask questions, attend seminars like this, talk to your primary care docs. But for those patients, after I ask what are their thoughts or have they thought about it, I usually talk to them in terms of the chronic conditions that they have. And I may say, hey, if you've thought about weight loss surgery, that weight loss could help your diabetes, could help you get to the point where you're on as few medications as possible, and even sometimes on no medications at all. Or for that person who has severe arthritis, sometimes the conversation is, have you considered weight loss surgery? Because so far you've been turned down from joint replacements because of your arthritis. Have you considered weight loss surgery as a way to reduce your weight to a level that which you'll have the knee replacement or the hip replacement? Similarly for folks, and I've had scenarios where people have had heart failure or kidney disease, where they are interested in kidney transplant and heart transplant, but weight has become a barrier. And the conversation is, there are places where people have weight loss surgery prior to being listed for heart transplant or kidney transplant, and that weight loss surgery can be an effective tool to minimize the risk associated with transplants in people who really need those. And so I really speak to each individual's chronic conditions, to kind of make the case that if they are considering it, giving them a picture of what can improve. People with high blood pressure similarly can get to a point where they're on as few medicines as possible or no medicines at all. And so the conversations are usually along the lines of, this is what you can expect. But I also lay the foundations for, I also communicate to patients that obesity, which is the disease that weight loss surgery and weight loss treats, obesity is a chronic condition. So it's a condition that doesn't disappear like infections. It's a condition that sticks around. It's a condition that's associated with weight gain and weight loss, but it's also associated with other diseases like high blood pressure and arthritis, sleep apnea, heart disease. And so the reason I think is really important is I really begin that so that every time I see them, I can continue to encourage them to engage in those behaviors that are beneficial to their health. And so for those who have gone through the process, have decided they want to have weight loss, have surgery, have had weight loss surgery, there's still a lot of work. There's still a lifetime of work that they will need to do to preserve their health. So they've taken a significant step and made a huge investment by having weight loss surgery. You, I want to be a consistent voice of encouragement to say it doesn't end the day your surgery happens. It doesn't end the 18 to 24 months where the most weight comes off. It's a lifetime thing, and it's about better health. And so really starting out with the message that this is a lifelong thing, and what you're doing is you're actually making an investment in the health for the rest of your life. And so, after talking about specific improvements that they can expect with weight loss surgery and weight loss, I talk about, hey, this is a chronic condition. And also, at least for me and my patients, the goal for me and my patients are more about better health and not necessarily about what the final weight is, over a time period. And so I laid a foundation that it's about better health, and that there are some behaviors that are beneficial just for the sake of it. Exercise is beneficial no matter how much you weigh. Making good food choices is beneficial no matter how much you weigh. Stress management, adequate sleep, all of those things are beneficial in their own right. And when it comes to obesity, those things are significant factors with obesity. And so really, really encouraging patients to kind of separate out those really, really key behaviors from the weight loss. Because unfortunately, I've seen a lot of patients in the last group who have who've been, for years and years, it's been about the numbers on the scale. And I can tell you that as a physician, I know that we in healthcare, unfortunately, I think many times we over rely on the number on the scale and the BMI, and not necessarily inquire about those key behaviors. And so many people have been trying for decades and decades to get those numbers on the scale to be less and less and less. And so and so many behaviors are done in the service of reducing those numbers. Unfortunately, when the numbers don't move the way we anticipate, many of those good healthy behaviors are stopped because they don't work. And in the reality, there's a lot of benefits that go away that they are beneficial. And so nutrition, exercise, sleep, stress management are important no matter how you weigh, no matter what you weigh, whether you're losing or whether you're gaining. Those are really, really important things. So the next group of people that I see usually, I see these people a little earlier in the process. So it may be a few weeks to maybe a month and a half before weight loss surgery, where we're going through and we're reviewing their chronic conditions to see, hey, are there any things that would make surgery more risky? So many times we're asked as primary care to provide what's called a medical clearance, where we assess the patient to make sure that there are no foreseeable problems that will make going under general anesthesia more risky. And so we'll see you and engage in kind of that type of kind of evaluation. Some people will need to see heart doctors before. Some people will need things like stress tests and things like that to just make sure that they can handle the surgery. After those things are done, there's no foreseeable risk. Then in the period, a couple of weeks before to a couple of weeks after, our role in primary care is a lot more supportive. We're here kind of, if you need them, to kind of help guide the chronic conditions that you have, to kind of help work in concert with the bariatric surgery clinic. But as you're phasing through the different diet phases, as you're approaching the surgery and then the surgery, generally for your chronic conditions, your medicines are significantly reduced, to see if you can kind of be stable without those medicines. Lots of blood pressure medicines are stopped. Diabetes medicines are significantly reduced. High cholesterol medicines, fluid medicines are reduced. And so for many of you with those chronic conditions, you may leave the hospital without any of the medicines that you've taken for years or even decades. Where I think is really important for me in primary care is, it would be really helpful for those conditions, particularly high blood pressure, for you to have a way of monitoring your blood pressure, particularly after medicines have been stopped. Most people are able to make it without being on any medicines. A small number of people continue to need medicines, albeit at lower doses, less medicines at lower doses. And so if you began the bariatric surgery with high blood pressure, I consider you to continue to have high blood pressure, whether you're managing it with medicines or not. And so it means always monitoring. So at no point do you get to not monitor your blood pressure. You don't have to measure it 16 times a day, but at least every few days, or when you feel bad, if you feel tired, weak, dizzy, let's make sure that your blood pressure hasn't dropped, or conversely, let's make sure it hasn't shot up. And you may need some additional medicines. For diabetes, similarly, good blood sugars can help with healing. And so it's important, whether you're on medicines or not, to continue to monitor your blood sugars. Um, People can have low blood sugar. So the combination of the weight loss with the nutrition restrictions immediately post-op, some people can have low blood sugars. And so having the ability to check is really, really important. Those are the two, those are the biggest conditions that may need a little bit more monitoring for people who had those before weight loss surgery. And so it's really important to kind of work in concert with the bariatric clinic and your primary care clinic. And just for the benefit of the doubt, let your primary care clinic know that you've had weight loss surgery, in particular, at least the date. Let them know the date so that they can check in on you, or be able to kind of, when you call saying, hey, my blood pressure is high, they can know, hey, 2 weeks ago he or she had weight loss surgery. This is different. This is different from last time. This is different. Or, hey, my blood sugars are dropping. This is different. He or she had weight loss surgery, so maybe we need to bring you in. Maybe we need to work out something else. So that's the second group. And then the last group is it's most complex and can be the most challenging group, is the group of patients who are many months out, or years, or even decades out from weight loss surgery. And that group can be as different as the man who has made every single appointment for weight loss surgery for the last 20 years, to the man who saw the weight loss clinic for 6 months after surgery and didn't follow up for the next 10 years. And so sometimes we in primary care don't know that a patient had weight loss surgery unless sometimes if we can see it pop up on the computer, or they tell us, or in some cases, and it is more common than I like, in some cases people end up with significant vitamin deficiencies, and you're scratching your head trying to figure out why their B12 is so low or why their vitamin D is so low when whatever you're trying doesn't bring it up, it starts a conversation and it's, oh, by the way, I had a gastric bypass 15 years ago. And that significantly changes how you look at that patient, because that's someone that you know needs vitamin D and B12, whether it's normal when you check it or not. That person's going to definitely need that kind of supplementation. Some people can have severe iron deficiency. And again, you wouldn't necessarily know, you may think it was a single episode that made the iron, the B12, or the vitamin D low, but those are the changes that can come from weight loss surgery, that these people will need lifelong supplementation. And so, and many of these folks, when B12 is really, really, really low, people can have symptoms of numbness and tingling in the extremities, trouble walking, trouble falling, and people can even have trouble with their memory when vitamin B12 is really, really low. And so sometimes people come in complaining of those things, and you find that, and then you uncover that they had weight loss surgery. For those who are closer to the surgery, those who are months from surgery, it's important to continue to encourage them in primary care, keep them on a regular follow-up, checking those chronic conditions that you were managing with medicines before surgery and now you're not. People who had diabetes before weight loss surgery still need regular eye checks, still need regular foot exams, still need routine lab work to make sure that their diabetes remains under control. Unfortunately, some people have diabetes that doesn't stay in the manage without medicine phase. So people may have to manage their diabetes again with medications. But for many people, instead of tons of medications that they have before surgery, now they can be only managed with one medication. And so just because people are having to resume some medications doesn't necessarily mean that you're having to use as many medicines at as high doses as you were before. But it's really important to continue to monitor that. And that's where continuing that relationship with primary care. So that person with high blood pressure, high cholesterol, diabetes, heart disease, who's had weight loss surgery, has done a tremendous thing for their health, but they still need the attention that those conditions require, because those conditions can change over time. And so in primary care, really, really, really encourage people at that point to, hey, let's just keep covering up. Don't get lost to follow up. A good number of people just disappear. They just disappear. What happens is they may go through 2 years of weight loss surgery appointments along with a primary care, and then boom, there is a 4 or 5 year period of, where are you? And many of those people, and sometimes the thinking is, well, I'm not on any medications, therefore I don't think I need to see a doctor or a nurse practitioner. And again, the challenge is, you really want to continue to monitor those problems, because you want to be able to intervene as early as possible. You don't necessarily want to wait until you've gotten to where you're getting complications. And so, this group is really important. Like, if I've talked to them early in their decision-making process and have had regular, I really encourage people, particularly in the, for me in primary care, just because of my background in obesity medicine, I know that the first year and a half to 2 years is an important period, for people who've had bariatric surgery. Research shows that the most weight lost happens in that time period. And so it's really, really important, while the weight is coming off, for people to lay those behavior foundations So while the weight's coming off and you're engaging in the exercise and the stress management and the sleep, look at ways to just make sure that you're going to be able to keep those up after that year and a half to 2 year period where the ease of weight loss decreases. And it's just part of the chronic condition of obesity that no one loses weight. No one will continue to lose weight forever. There'll be a period of leveling off. And for some people, that period may be, in terms of numbers, that number may be higher than they want. But really encouraging those people to continue with those behaviors, because that weight loss is a significant improvement in health. And so really, and it takes a relationship with patients. It actually takes a lot more time to really look and see beyond the numbers in a primary care clinic. And that's a part of the job that I enjoy the most, the time that it takes to really leverage that relationship that I have with patients, of saying, hey, you're going to have a period of time where the weight loss is not going to be as hard as it used to be. Use this time to develop habits. Find you a exercise or a group or some type of health related behavior that you fall in love with and you continue to do. Find you something that after 2 years is going to be so enjoyable to you that it brings you back to it. When the weight stabilizes, it brings you back to it. Because another thing that I commonly see, and it's not wrong, is not a failure, is, and it's also reflected in the research on weight loss surgery. So almost every study, long term, of weight loss surgery, where they've looked years and years after people have had surgery, there's a small amount of weight gain. So there's a leveling off, and there seems to be, when you look at everybody in all the groups, there's a small degree of weight gain. What that means is that's just the body who began with the chronic condition called obesity, which continues. It's just the body adjusting finally to the changes that the surgery did. And probably a little bit more technical for this, our bodies are beautifully designed to prevent us from starving. And at the end of the day, that machinery is going to kick in. So nobody loses weight until they lose down to nothing. Their body's machinery is going to kick in to kind of go back to that pattern. And there's many different pathways to prevent us from starving. And so some of that machinery can kick back in. And that's when you can see the weight loss kind of leveling out, and then there's a small degree. And in fact, in the obesity medicine community, that there's a push to define kind of, how do you define a scenario where a person had weight loss surgery and things didn't work. So, treatment failure, like with every other treatment, how do you define that? And I think, and the push is to define it not by the number of pounds that have come back, but actually to define it by the degree and the number of comorbidities that have come back. And so for a person who's lost 150 pounds and they've gained 20 back, that person may still be enjoying the significant benefits of the weight loss surgery, even though those 20 pounds may be really, really distressing. But that person doesn't have to go back to taking high blood pressure, doesn't have to go back to taking medicine for diabetes, is able to sleep without CPAP, is able to move without significant pain for arthritis. And so those are the people that, there's an opportunity in primary care for us to encourage those people to continue to follow up with the weight loss clinic. Because there's also been studies that show that when you look at people who've been successful compared to those who haven't, the degree of follow-up is a factor. So those people who continue to follow up seem to have a better chance at success. So even if the numbers don't look and feel like you think they should and you want them to do, um, following up, with the weight loss surgery and primary care, continue to follow up, because the best outcomes happen there. I mean, there's a lot of factors that go into it. Um, so, um, and then in that last group is kind of a subset that I want to talk to you about, that I see it a lot. There are people who before weight loss surgery had significant joint pain and arthritis, and the weight loss surgery allowed them to lose weight and be more comfortable. But there comes a point sometimes when the wear and tear, it just crosses a point of no return. And so many people still need a hip replacement or a knee replacement, or to have aggressive management of arthritis even after weight loss surgery. And that doesn't necessarily reflect a failure of surgery or failure. It just reflects our joints can only take so much. And that for some people, the, there was just so much that was kind of built up before the weight loss, that that at some point it was going to get to the point where they needed a joint replacement. And for some people, it can be pretty distressing. So many people will kind of be down because, they hoped that weight loss surgery would put off or even eliminate the need for joint replacements and things like that. And so it can take some counseling through it to just kind of let them know that, hey, you didn't do anything wrong. This is just what happens when a joint has just gotten to the point where the wear and tear has just crossed the line. And so, and I encourage people, and many people confront this, during a period where they're intensely exercising. And so I have people who have lost the weight and they fell in love with weightlifting. And when they squat, their knees kill them or their hips kill them. And unfortunately, it can be pretty disruptive to that patient, because they may have just gotten to that point where they can't squat and lift the weight that they want, and that they may need something more aggressive for the joint. And then other people may, some people may have such a great experience with surgery that they don't remember how bad their joints were before surgery. And so it can kind of be, distressing, like reliving something that people thought was long over. And so paying attention, to your body, exercising, isn't always comfortable all the time. But if the pain continues to increase the more you do it, having that conversation with your primary care doctor and saying, stopping it, having that conversation with your primary care doctor to just evaluate to see, hey, could you be one of those people that need something else for your joint disease that has just reached that point? And so I'll summarize just in primary care, primary care with an extra training in obesity medicine, my relationship to weight loss surgery. I summarize by saying obesity is a chronic disease. There's a lot of other diseases that's associated with obesity. Weight loss surgery is an effective way to lose weight, to improve obesity, and to improve those conditions like blood pressure, cholesterol, diabetes, heart disease. Um, Weight loss surgery is a significant thing. It's a powerful tool, but it's a significant tool, and it requires a significant effort on your part, along with, particularly for the chronic diseases, coordination with your primary care doc. Just like obesity, a lot of your chronic diseases still need to be monitored. And so it's not a get it and forget it type procedure. In primary care, I encourage everyone to continue to follow up. to continue to follow up and continue to kind of get those evaluated. And, the goal is to continue to have those problems, but not have to manage those problems with medication, that you're managing those problems with the weight loss that you're maintaining, the exercise that you're doing, the nutrition choices that you're making, the stress that you're managing, and the sleep that you're getting. And then just to say that some weight gain is expected, and that's not failure. So don't miss the appointment. Don't miss the follow-up appointments because the scale looks different. There's other factors that's associated with the numbers on the scale. And so do make sure you continue to follow up, primary care and the bariatric clinic. And so with that, I'm going to pause and answer questions. Okay. And so there's a question about hair loss. And that's actually a big thing that comes up in that's a big thing that comes up in primary care. It's a big source of distress, particularly as people are losing weight. I've had more women complain about it than men, but it happens to men too. So for the most part, the hair loss associated with weight loss goes away. And what we think is the cause of the hair loss is sometimes when your body goes through a significant event, and for many people that event can be stress, pregnancy, surgery, they have a situation where the hair stops in the phase of growth. All the hair all the hair on the head stops in the phase of growth. And what usually happens is people have painless, non-scarring hair loss that kind of is distressing, but the good news is it goes away. And usually it goes away about 3 to 4 months. And so for the people who are dealing with it, I usually tell them give it enough time. Many people supplement biotin, add biotin to their supplement. I'm fine with that. Still, what happens is most people end up a few months, the hair is back, and they've kind of moved on. But it is definitely distressing. For some people, weight loss surgery is their first surgery. For others, and what I don't know and haven't found is, what about the event makes the hair do what it do, kind of stop in that phase of growth and kind of all fall out and then come back. But other in people's lives, and again, more women complain about it. Childbirth is a time where there can be the kind of painless, non-scarring hair loss, and it can happen with bariatric surgery too. Taking biotin supplements won't hurt you. Just make sure you don't overtake them. Don't take too many biotin supplements. Biotin toxicity is uncommon, but just make sure you don't overtake it. And then as you're looking at supplements, just make sure you're not doubling up on some of the things that you have included in your multivitamins and things like that. That you certainly aren't going to get any better by doubling up on some of the minerals that you don't need a lot of. So biotin is fine. The multivitamin, continue B12 and the vitamin D, just kind of more for the, maintaining those levels because of the weight loss. How much weight can you lose in 6 months? So each person is different. Everybody is different. There are some people who are the fast weight losers, and some people are the slow weight losers. Some people lose weight fast, some people lose weight slow. It's hard to predict. It's hard to predict how much someone will lose with the weight loss surgery. It's just each person is each person has individual kind of differences, and then Sometimes there's other factors like how old the person is, the intensity of exercises, the type of exercises can affect the amount of weight loss. Um, and then kind of nutritionally, there are things you got to make sure the hydration and the protein supplementation. Um, Teeth. I haven't had many people complain about. So the question was that there's questions about, or I think question about the effect of weight loss surgery on the teeth. That some people have had teeth changing colors and decaying. Um, I'm trying to think. I've certainly not encountered that, and I'm trying to think of ways in which uh, hmm, you know, so I think if getting the um, right amount of hydration, avoiding dry mouth. Um, I guess I don't know if there's a role in like artificial sweeteners in terms of affecting the kind of color of the teeth. Just kind of routine dental care. I'll just recommend the routine dental care, like the routine things that you would do before weight loss surgery, the 2 dentist visits and cleanings per year that you would normally get. That and I think working with the dentist, that if you notice something, having the dentist notice it early, it can kind of help improve that percentage. Okay, so there's a question about the percentage of patients with the sleeve that have vitamin deficiency. Um, Now, that's not a clear cut answer for you. What I will say is 100% of people with a sleeve have alterations in the normal um, absorptive pathway. So, and it's more important for B12, vitamin D, and iron. And so, because of the large amount of the stomach that's removed in the sleeve, your B12 absorption is affected. Now, how many people will have severe deficiency? It may not be a big number. It may not be a big number, but attending to your vitamin D. So there are some patients who are able to maintain their vitamin D and vitamin B12 through the food that they can eat. But again, they're still having to kind of maintain it and pay attention. And so I would probably say in primary care, 100% of people who have weight loss surgery need to pay attention to their vitamin B12 and vitamin D, even to the point of bringing it up to their primary care doctors. Insurances, particularly Medicare, I mean, requires such a um, significant threshold for checking regular vitamin B12 and vitamin D. And so your your primary care doctor may say, hey, you're in a low risk group and your insurance don't pay for B12 and vitamin D. So you may have to remember to say, hey, I had weight loss surgery 3 years ago, and I'm not taking B12 and I'm not taking vitamin D. And so sometimes I've seen, those people where we put vitamin D deficiency and B12 deficiency on the chart so that it can prompt us to continue to address it. But I would say 100% of people need to worry about it. And if you're not taking the supplement and you don't know that your levels are normal, talk to your primary care doc, talk to Vivian. I know B12 and vitamin D are part of the post-surgical weight loss labs. And so if you're far out and you're thinking about it and worried about it, and you aren't going to see Vivian or Dr. Pinson or Dr. Carlton and follow up, then you ask your primary care doctor. So there's a question about what about excess skin? And this is a common question. It's actually a common concern for all forms of weight loss. And what I will tell you is there's some stuff that you can control and there's some that you can't. And so in terms of the amount of excess skin, so the amount of weight that you lose, there's definitely going to be um, there's definitely going to be excess skin, and that's just from the skin having stretched to accommodate when you were heavier. The skin doesn't necessarily retract. Um, it doesn't normally retract like we want. A lot of the retracting ability of the skin goes away with the stretch. So things that people can do to minimize the impact of the excess skin, um, uh, building muscle can help reduce the impact of excess skin, although there still may be some. Um, Building muscle and kind of, and then the last thing is that at some point, many people have to have procedures where they remove the excess skin in situations where they, in situations where it causes trouble. Sometimes it's excess skin can cause trouble. It can, particularly in a situation of chafing, it can cause sores and it can make workouts uncomfortable. So many people have to kind of wear binders or things like that to address the excess skin. Um, Unfortunately, it doesn't matter how you try, but you can't, unless you're doing it surgically, you can't say I want to lose 100% of my belly, 0% of my thighs, 10% of my upper arms. What happens is the weight comes from, it comes from the areas that they come from. And so skin is something to really think about. Another challenge that, unless there's significant issues in terms of like sores and infections and things like that, procedures to address excess skin is not necessarily covered on insurances. And so the financial impact of addressing the excess skin is something to, consider. It's not impossible. There are people who are able, that are plastic surgeons in the area, who kind of work with post-op bariatric surgery patients. They like for your weight to be stable. They like for your weight to be stable. They like for your weight to be below a certain level. And I'm not sure which one. Um, um, so they are, are kind of, they're out there, but it's tough. The excess skin is tough, but it's, I think there's still a significant improve, like, the weight loss really goes a long way. And the excess skin is definitely something that, is surmountable. There's another question that said that for people who are waiting, um, who's waiting for surgery for 6 months, what can they do in terms of food and exercise? So the exercise part, I'll actually kind of talk about that a little bit. Is, we are in different times. We're in the pandemic. So exercising is definitely more challenging now than it was 5 months ago. And so the need for flexibility and creativity is more significant now. So for those, are saying, hey, I feel like I'm in a holding pattern. What can I do until I can have my surgery? Well, use this opportunity. Unfortunately, this 6 month period is kind of been defined for you. And most times it's insurance companies that set an arbitrary time period at which, you know, there's nothing magical about the 6 months other than that's what insurance says, or that's what the process says. So what you can do is take this opportunity to find foods that you enjoy that may be more nutritious. I mean, that's if you're not already consuming nutritious foods. But this would be a period of saying, I know that in 6 months, I'm going to have weight loss surgery. So this is the time where you're like, well, let me explore all of the protein supplements. Let me find my go-to. Let me find my go to. Let me explore new foods. Let me try new exercises that I can enjoy so that when surgery happens, I've already fallen in love with Zumba or whatever it is that you enjoy, so that you have actually used this 6 months to explore things. If surgery is 6 months down the road, and I know insurances say you have to try, this is the period where you can just untangle everything from that weight loss. While you're waiting those 6 months, say, hey, I'm going to eat right because I want to find stuff that I enjoy. I'm going to exercise so I can find what I enjoy, not necessarily because the number on the scale needs to be a certain amount. And I think that if you're able to do that, then when surgery comes, then you're able to, you have a great chance of being successful. Now, there is data out that people who lose weight before weight loss surgery lose more weight than people who didn't lose weight before weight loss surgery. And so there's some benefits to weight loss before weight loss surgery. But I wouldn't necessarily let that be the number one goal. Number one goal is to engage in health behaviors and nutrition and exercise. I mean, there's a lot of explorations and a lot of fun to be had. And for you, if the food don't taste good and the exercise don't feel good, quit. Don't do it. Try something else and just keep exploring. There's the next question is weight loss surgery for females over 60 often successful? And the answer is yeah. I mean, Medicare has started paying for weight loss surgery. I mean, 60 is young for Medicare, but Medicare people get Medicare at 65. And so in terms of improving health, many of the chronic conditions that, people who are over 60 have accumulated, high blood pressure, diabetes, arthritis, heart disease, many of those, are significantly improved, and people can have good, and in fact, in terms of my patients, the group that I'm paying most attention to are those over 60 who are having weight loss surgery, and they're doing just fine. They're doing well. Now, I mean, there's some, expectations that people have. By the time someone is 60, many have realized that just because you want something to be a certain way doesn't mean it's going to happen. And so they may be more, maybe more okay with some of the things that aren't 100% in our control. And so, you may, I think it's a growing group, and I'd be interested to see, or I wonder if there's an opportunity for like the, over 60 group to kind of have like some supports, because for many years, insurances didn't pay, or there were age maxes in terms of weight loss surgery. Now, I don't know anybody who's 70 who's had weight loss surgery. And I don't know anybody, older than 70 who's had weight loss surgery. I think that people who are over 60 and in their considerations, I think, you're going to need to kind of firm up that decision before, you kind of get older, before 70 rolls around. Because I don't think, I don't think there's some age-related maxes, but I haven't seen anyone over 70 who's had weight loss surgery. And it also is helpful for men over 60. Okay, so this is a tough one, but actually no, this is actually incredibly common. So young women are also having surgery. So young women who the question was, what about periods after surgery? So for many women, having extra weight can mess up the periods. Periods can be irregular or not happen at all. And with weight loss, the periods can come back pretty regularly. And so for many women who've had years and years of no period, with enough weight loss, the periods may come back pretty regularly. And this can be distressing, but it's also really important for me to bring up fertility. And so with weight loss, women become more fertile. And it's actually encouraged that women wait 18 to 24 months after surgery to get pregnant. And so it's definitely worth having that conversation. If as a woman, if you are, as a woman, if you are in the age where I mean, and I wouldn't let age alone kind of determine fertility, because if you're not 52 or 53 and you haven't had a hysterectomy and docs it, and you're not in menopause, and you've had weight loss surgery, then asking your primary care doc or your gynecologist, about, hey, what's my true risk of getting pregnancy, is strongly encouraged. That women and men use use methods to not get pregnant, particularly in that critical period at 18 to 24 months after surgery. That women can have babies after weight loss surgeries, and the babies can be healthy, but it's a significant, it's definitely a significant event if you're less than 18 months to 24 months from weight loss surgery and you're pregnant, because there's a certain degree of weight gain from pregnancy. Nutrient deficiencies are a little bit tougher. But back to the periods, with weight loss, periods come back and they can become more regular. And that can be, and if it's a problem, if the periods when they come back are much heavier, then you may be more likely to have iron deficiency because of the periods. And so that may be something that needs to be addressed from your primary care physician or nurse practitioner or gynecologist. Question was, someone has diabetes and high blood pressure. How long in the surgery will you be removed from the medicine? Usually you're told the day before the surgery to either take a small amount of medicine or none at all. And then many people are discharged from the hospital on none of those medicines, if the blood pressure and the diabetes medicine. And it's just because there's a high risk of low blood sugar, there's a high risk of low blood pressure, particularly in the post-op period. So that many people, and I say most, leave the hospital not on the chronic medicines that they were on before they went to the hospital. Now, there was a question about what foods will I no longer be able to eat. So that has multiple answers. The first answer is, in the short period of time, probably at least definitely post-op, and you're not going to be able to eat anything that occupies a lot of space in your remnant stomach. So, you're not going to be able to eat a lot of space occupying foods. So breads and those things that kind of soak up water and expand, those things are going to make you uncomfortable and even sick. And so you're going to have to, those are things that you're going to feel bad and you won't eat. Now, over time, that restriction won't hold up. And so you will have to make choices not based on what'll make you sick or not, but based on how nutritious it is. And so you'll have to make those decisions later on. And so what I encourage people to do, because it's a really important question, is look at this as a time to explore and see what you like. Don't see this as, for 18 months, my body is preventing me from overeating. Because for those people who look at that way, they're going to find a way. They're going to find a way to where they're going to find a way to get those. And some people end up later after the process, find a way to eat high calorie, low volume foods. And those are like the tea and juice bread type thing. Those people are getting a lot of calories in a small volume. And so what you're gonna have to do is at least early on, you're not going to be able to take stuff that's going to make the stomach stretch, because you're going to feel horrible. But later on, what you're going to do is what you're going to do is you'll have that ability. So now you won't have anything stopping you. The next one is gastric sleeve the same as what used to be called stomach stapling in the 80s? I think there's some similarities with the sleeve and stomach stapling, but I think the sleeve is a little different, because with stomach stapling, some of them there were kind of bands where they would staple around. Some of those things there was rearrangements, like the gastric bypass, where they rearranged things and left you with a remnant stomach. But I think the concept is similar, to where you end up with a reduced volume of your stomach. And with the sleeve, the stomach volume is reduced 80 to 90%. And that reduction in kind of how it affects nutrients is kind of what leads to the weight loss. It's that reduction, but it's also how fast nutrients can get into the intestines, and those can induce changes that can cause the weight loss. And then this next question is, does weight loss surgery have any effect on testosterone? So significant weight loss of any kind can actually improve testosterone levels in men. And so fat tissue is not benign, so it's just not insulation. It has hormones, and fat tissue can tend to have machinery that can produce more female hormones, and that can affect testosterone levels. So significant weight loss can cause improvement in can cause an improvement in testosterone levels. So men who've had weight loss surgery, better testosterone means better fertility. So if you're not, if you're not ready for more kids, special attention needs to be taken to prevent pregnancy for men. So for women who have weight loss surgery, fertility increases. Men who have weight loss surgery, you can expect some improvement in fertility, and you can expect some improvement in fertility, in testosterone levels. This next question, someone's saying they were interested but didn't do it because of, other ones, just kind of being talked out of it. Kind of how do you get others to change their mind about weight loss surgery? For some people, it's, for some people, seeing your experience and seeing how your health has improved. For some people, that can, I will tell you that the decision to have weight loss surgery, it's a significant decision. But when you make it and you are sure of the reasons, that you believe you need it, then that's all you need. You're going to need support. It's a big deal. It's a big deal, and it changes so much, because food and eating food and eating also does for us more than food and eating is a social type thing. And so first you have to be confident in the reasons why you want to lose weight. And if you are, maybe proceeding, even if, others aren't as supportive, lean on people in this support group. Talk to people who've had it, talk to folks who've had the surgery, ask all those questions, how they've dealt with, change in relationships. Relationships can be strained because of weight loss. One partner has lost weight, the other partner is wondering about, now that they've changed, are they willing to change me too? So, but really reaching out and having a support system. And that for some people, I encourage everyone to come to the decision on their own. And so, so what I do is I don't push anything on others. I talk about what the benefits could be if they were interested. But the reality is, there's no value in convincing somebody to have surgery who doesn't want to have it, because they're probably not going to have the outcome that they can if they were convinced already. And so my advice would be, be the example, show them, the changes that, and then some people could do some of the changes that you're doing when you're on the liquid diet and you're doing the transition. They can do it with you. They can exercise with you. And, and they are kind of engaging in that improvement, even if they didn't have the surgery. And then the next question is, somebody asked about drinking a carbonated drink. So you can drink a carbonated drink. You probably won't feel good drinking a carbonated drink. You're going to feel horrible. So the issue with the carbonated drink is, our gut, at least the way the nerves are in our gut, you can slice an intestine and people may not notice. But if you stretch an intestine or stretch a stomach, you're going to feel horrible. And so carbonation can give you more stretch than fluid. And so it's encouraged to, avoid carbonated beverages, particularly if you're trying to get food in. So if you're trying to get your protein in, and your water, you may want to avoid carbonated beverages, because that's going to decrease the amount of water that you can take, just because the carbonation is going to expand. And so, being around people who had weight loss surgery, sometimes people can be too much in a hurry and end up in a scenario where they're in the bathroom throwing up. It started as a nice dinner, but unfortunately they were a little bit too hurry. It took a sip of a carbonated drink, and while they were chewing, and it just created a scenario where the stretch, it was just too much, and so people ended up throwing up. And I've been around people who kind of still kind of get ahead of themselves and end up really sick pretty often. And so, I would encourage you not. It's hard enough getting, I've experienced it from kind of people close to me having surgery. It's hard enough getting the water in. That if you just focus on getting the right amount of water in, you probably aren't thinking about anything else to drink. That with the size of the stomach and the coordination, you're not going to be able to, you're going to have to pay attention to when you drink water and when you eat. That where we would normally have a water or a liquid with our meals, that can't necessarily happen because of the size of the stomach that you're left with and the significant symptoms that come from when you stretch it. So let's see. So I know Vivian has sent you a message in text about attending. I want to thank you for giving me this chance. I really enjoy, helping people improve their lives, and I'm thankful for that Vivian is kind of, Vivian and Dr. Carlton and Dr. Pinson have kind of given me a chance of adding my perspective. We're all in this working together, and our goals are better health for all of y'all, and how we there was a question about, is birth control okay to take after surgery? Yes, please. Okay, so Vivian said for the first 3 months you can't have oral birth control. And then, so now she said IUDs, patches. You don't want any hormones. So in the first 3 months, the concern is about the risk of blood clots kind of from surgery. And so the first 3 months, they want to avoid hormones, at least the higher levels of hormones. So that comes with the patches and the the pills. The IUDs that are placed, the hormone levels are so low, and it's thought that they don't give you the same risk as the ones you take by mouth or the patches. But definitely attention to, to birth control methods. So hormones aren't, the only way of preventing pregnancy. So men and women kind of paying particular attention to ways to prevent pregnancy, definitely after weight loss surgery. All right. Well, y'all have a great night.